Well, hi everyone, and thanks so much for inviting me. And I'm really pleased to be joining with you tonight. And I've been really interested to hear all the presentations that I've heard so far. I think I came in halfway between Sylvia's, and I'll be listening to everything else from the recording that I think will be posted later. So thanks so much for having me, and I'm really interested to pick up after Agnes, because she kind of left off at a point where I would like to move on from. So thank you for that. That's really lovely. So I'm going to talk a little bit tonight. I'm not using PowerPoints because I thought by now at the end you might be tired of looking at PowerPoints, and I thought I might just try and be interesting to look at on screen myself. So see how we go. So I'm going to talk about nursing leadership and standpoint, and I think this is a real opportunity for some transformative collaborations in nursing. So every year, every week, every day, every hour, day and night, nurses around the globe champion public hygiene. Hand washing, hand hygiene, sneeze and cough hygiene. We care about clean. We care about safe, and we strive to make things better for our patients, whether they're individuals or families or groups or communities, or we could say even nations. Collectively, we are hygiene champions. Hand washing is our first lesson on day one in nursing schools everywhere. Every procedure we do starts with hand washing, and it's not considered complete until our hands are washed afterwards again. It's drilled into us from day one, and we master it like the professionals that we are. In fact, we love it so much, we started to collect statistics and monitor hygiene practices in relation to patient health outcomes about the time when Florence was not much more than a girl. You would think with over 20 million nurses spread out across the world, we would have some influence, that people would be interested to learn from our experiences. You would think that 20 million nurses couldn't all be wrong. After all, we are rated the most trusted profession in the world. And in fact, nurses make up about 60% of the entire health workforce in the world. You would think that with the onset and in the midst of a pandemic disaster, the first discipline you would seek advice from, you would call out for help, would be a nurse. All the nurses, wouldn't you? Or not? Today, I'd like to present you with the ironical argument that the world has largely failed to meaningfully engage nurses to lead the disaster response or recovery, even though we represent a discipline that is perhaps best prepared with a practical and scientific knowledge base to do so. And I guess it's time to consider why that might be the case. I think there are a number of factors that we could consider. Firstly, caring work has traditionally been considered women's work. Caring for children, caring for older people, caring for people with disabilities. Caring work is associated very often with social oppression, vulnerability, and political powerlessness. A second factor is a default hierarchical social order persists that reinforces a dominant medical and patriarchal dominance in healthcare, and its perpetuation positions caring sciences, for example, nursing conducted by women, to be relegated to lower social status, effectively oppressing political power and influence, even when the world is faced with its most complex hour, a pandemic. explicitly related to core nursing expertise, and yet we're rarely consulted. And it's the case that 90% of the world's nurses are women. A third factor might be around caring tasks, supporting the basic life-sustaining needs of the most vulnerable in society. It's carried out in such large numbers and so frequently that our global economies cannot grasp or fathom the extent of the contribution, nor put an economic value on it. And so society instead offers gratitude as a remuneration of sorts. A confused society develops some narratives, even fictions, about likening nurses to superheroes and angels. Superheroes and angels don't die, they don't benefit from advanced educational training programs, and they don't require salaries, while actual nurses require all of these. And especially in the context of where we find now in many countries, including Australia, that nurses are one of the populations at the highest risk of contracting COVID-19 due to their transmission proximity to patients with COVID-19 in their workplaces. Collectively, as a global society, are we throwing our nurses under a bus, exposing them to life-threatening risks, and then we offer to clap applause in order to offer our gratitude? Is that enough? In July, my colleagues and I, some of which are with us tonight, published an article about this very topic, and we suggested that there's some fundamental changes that need to take place. Firstly, we challenge the biomedical paradigm as the singular lens for solving health problems on all scales. Health outcomes are more suitably aligned to health and social paradigms, and a power shift might be required. A transformative collaboration needs to occur where our caring sciences and scientists are included as equal partners. And this will require economic, political, social, and egalitarian redress. Some groups will lose some of their power and others will gain new power and influence. And this dismantling of a biomedical power will be uncomfortable for some. And rarely do the more powerful yield to the less powerful. So we have some discomforts to navigate ahead. Secondly, nurses have a unique perspective and knowledge that is informed by their, to date, social oppression, a standpoint, if you like, that enables an insight and an advantage about the lived experience of oppression. Lessons from caring for people with COVID-19 will inform response and recovery and future preparedness. And this needs to be leveraged for public good. Thirdly, nurses need to recognise and reframe their leadership and seek to lead. We've seen over and over again how the world has relied upon the high quality, highly sophisticated nursing care, underpinning best practice and safe treatment, together with unswerving compassionate care. We've got plenty to contribute, and we need to stand together to support each other, spurring each other on as leaders in healthcare and not undermining each other as nurses sometimes do, falling into the trap of perpetuating our own social oppressions. Rather, we need to act to emancipate ourselves as a collective. And this is crucial if we're going to work through recovery and in preparation for other similar disaster events in the future. Our nursing contribution is a vital voice and our leadership is necessary. We will need to transform ourselves if we wish to enhance our scope to meet the needs of the changing world. And we'll need to be increasingly agile, transformative, and amplify our voices, power, and influence if we are to adequately address the changing needs of the world population, with our core focus on promoting and improving the determinants of health and well-being, recovery, and robustness of people as they encounter challenging health circumstances in their lives. Our unique standpoint as nurses provides a foundation to leverage wider community recognition and authentic respect for our health and well-being knowledges at a time when the world cannot do without us. We will need to rise to be powerfully kind, influentially ambitious, and entrepreneurial in our health problem solving going forward. It would serve us all well to learn these lessons quickly and to position ourselves in readiness for the next big wave upon us of human distress. Many people the world over are experiencing financial distress as the economies around the world crumble, unemployment is growing, businesses are failing, the risk of homelessness and food insecurity is escalating, and hope for the future is diminishing for many. We're starting to see suicide numbers are climbing, depression and anxiety conditions are increasing in prevalence, and the mental health of so many around the world is at risk. And we can really see this tsunami headed for our shores. Our nurses have much more ahead, and our leadership and our care will be needed there too. So we're not anywhere near off duty yet. It's a transformative time for the health landscape ahead of us if we can embrace the necessary changes in our society. So nursing leadership really must be ready for this challenge, and all health professionals need to consider new ways to engage with nurses in collaboration as we work to mitigate the health problems, mental, social, emotional, and somatic, all arising from COVID-19 pandemic.